Hello, everyone. Good afternoon. Good afternoon, everyone. Hi, Dr. Cecilia. Thank you so much for joining. I appreciate you being here. We're going to get started in just a couple of minutes. Today, I'm going to be responding to a request to talk more about pap tests and how frequently women should get them and what some of the results means, especially high cell. Hey, Lee, thank you so much for being here. I appreciate y'all being here. Um, I'm going to give another minute or so for people to join, but we're going to be talking about pap tests today. Hey Pam, thank you so much for joining. I appreciate y'all being here. I'm going to be talking about pap tests today. Some of the evolving guidance around when women should get them, and then also what the results mean. So thank you for being here. We'll get started in just another few seconds. And also, as you guys join the Facebook Live, please like or share if you think there are some other people who might be interested in this information about pap tests. We're going to be talking for about 20 minutes today, and I'm looking forward to sharing information. Let me make sure that my phone is off. Hey, Sean, thank you so much for being here. I appreciate it. Today we're going to be talking about pap tests and some of the evolving guidance around when women should have them done for the first time, and then, you know, on a schedule, and then also what some of the results mean. If you think you have someone, a family member, a friend, a loved one who might be interested in this information, please by all means like my page, Dr. Madeline, and then also share this live video with them. And we'll be talking for about 20 minutes today. So let's go ahead and get started. Welcome to today's Sunday chat with Dr. Madeline. I am Dr. Madeline, your board certified OBGYN, international speaker, and published author. And I help very busy women who are juggling a lot try to maintain tailored GYN services and access to birth control. And ultimately, you know, that's to help women be as free and as in control of their lives as they can be. And so I'm excited to talk with you guys today. We're going to be talking about pap tests. Again, please by all means follow me on different social media, and that's Facebook, Instagram, and Twitter. And my tag is Dr. Madeline MD. That's DrMadeline. So let's go ahead and get started, because we're talking about pap tests, but I want to kind of drill down on what it means when we say pap tests, because in the years that I've been doing this, we sometimes each have different ideas about what a pap test entails. And so I say that because when a woman is getting a pelvic exam, that pelvic exam whereby a physician or a nurse practitioner or midwife might be placing a speculum inside the vagina for a variety of reasons, maybe to look at the cervix, maybe to get a swab, maybe to investigate for something else. It doesn't always mean that they're doing a pap test, okay? So when a woman has a pap test is when that speculum is in the vagina, and y'all know I'm visual, so shout out to all the visual learners out there. So it means the speculum is in the vagina, and for the pap test, we're actually getting a sample of the tissue right here at the bottom of the womb, which is also the cervix. And as you can see, that cervix is at the end of the vagina, which is why we use the speculum, so we can see the cervix to do the pap test. So the reason for the pap test, and you guys may remember this from when we talked about different GYN cancers previously, the reason for the pap test is to screen for cervical cancer. So cervical cancer is it's decreased over the last 40 years in the U.S. and actually globally because we have the advantage of the pap test, or Papa Nicolau test is the full name, and that was invented back in the 1950s, and it became more widespread, and now it's considered the front line for getting cervical cancer screening. And it's one of the most effective screening tests we have. As you guys know, a really good screening test is one that can detect a disease or a situation before it gets bad. So that by doing Pap tests on a regular schedule, we're able to detect any early signs that might give us a clue about there being a potential for cervical cancer, and that allows us to intervene as early as possible. Okay, so that's why we do the Pap test. So I wanted to cover this topic today, not only because a few of you guys have asked me about what Pap tests are, what we're looking for, how often they should be done, but also because there's some evolving guidance in terms of how frequently they should be done, and I wanted to touch base with you about those. And then I also wanted to address some questions that came up about what the different Pap test results mean. Okay, so that's what we're going to be talking about today. So again, Pap tests are a cervical cancer screen. So I'm going to give you a little bit of a history. So, and I'm going to date myself. So when I was coming up, it was required that Pap tests be done for all teens/women, young women, by 18 years old. They were actually a required part. If you went to a provider and you were 18, that was something that they just automatically did as part of your workup. If you were leaving to go to college, a pelvic exam and a Pap test had to be documented on that college admissions physical exam. So that was where we are then. Then fast forward to about probably 10 to 15 years ago, we had more information. The beauty of science is that when we know more and we have more information and research, we try to do better. And so fast forward to about 10 to 15 years ago, the guidance changed. And it changed because it said, we're over screening these 18-year-old women, 19-year-old women, and we may be doing them harm by doing all these Pap tests so early. And so after looking at, tons of data, years, decades of research, the decision was made by some professional organizations and experts in the field that we would delay the first Pap test until age 21. And so what you see most clinicians doing these days is offering the first Pap test by age 21. Now, there are always different circumstances. As each of you talk with your different providers, there may be reasons to do a Pap test a little bit earlier if something unusual is going on, or maybe even a little bit later if the person maybe is not sexually active yet or something like that. So again, it's always important to talk with your provider, your clinician, and make sure that you have the best plan of action for you. But the overall recommendation that was updated about 10 plus years ago was that women could go start getting a Pap test by age 21. Oh, thank you, son, for being here. Welcome. Thank you, Janet. Thank you so much for being here. I appreciate y'all being here. We're talking about Pap tests, which is a screen for cervical cancer, and going over some of the recommendations about when it should be done and what the results mean. So as I was saying, so the recommendation has been for the last decade and a half or so that women have their first Pap test by age 21. But I'm going to throw in a caveat because one of the things that's going on, and one of the questions that came up from one of the watchers a few weeks ago was, hey, someone put it in the box, DM'd me, hey doc, I heard that the Pap test screen is now going to be pushed back to age 25. And if there were any of you who saw that on the news, yes, that is correct, but there's a caveat. So in OBGYN, as is the case in a lot of medical specialties, there are different professional societies and bodies that look at all of these data and all of this information. And so the professional organization that had a meeting and looked at the data and made that recommendation was the American Cancer Society. Okay? The American Cancer Society, as of this year, is recommending that the first Pap test doesn't have to happen until age 21. And that initial screen, actually, let me revise my language. The first screen for cervical cancer doesn't have to happen until age 25. That's what the American Cancer Society is now saying. And that first screen for cancer can be only with an HPV test, or human papillomavirus test. And I'm going to talk a little bit more about what an HPV test is. Now, I make that separation because the other professional bodies, and a lot of, most of us OBGYNs, we go by the ACOG guidance, or American College of Obstetricians and Gynecologists. So that body, the ACOG professional body, still is basing our recommendations for our patients on the recommendation that the first PAP be done by age 21. That's still where we're at. Now, what happens, and it's not uncommon at all, a lot of the different professional organizations look at data at different time points, and then it may be that in 2021, ACOG changes its guidance to match with the American Cancer Society, but it may not. That's still the case with mammograms, which is a whole different, we'll have that conversation later in the month because it's breast cancer screening month. But for mammograms, there are different recommendations by different professional groups and experts, okay? So yes, it is true that the American Cancer Society has said that the initial test for cervical cancer can happen at age 25. So let's talk about what that means. When they say you can do that test at age 25, they're talking about an HPV screen. Now, HPV is important because there are types of human papillomavirus, or HPV, high-risk types that are associated with cervical cancers. And the rationale behind this scientific recommendation is that if you get an HPV screen at age 25, and that HPV screen is negative for high-risk cancers, that you are several years away from, even if you did acquire HPV, you would be at least 7+ years away from any HPV introduced into your system to lead up to cancer. So that's the rationale behind that. Now, one of the things that many GYNs are still doing is we're doing a dual test. So there are some bodies who just do the HPV test, and then there are bodies who do the PAP test with HPV. So there's primary testing with HPV, and the other way we screen for cervical cancer is a PAP test with your HPV. Okay, and so most people are still doing the PAP test with HPV. And so what that does is, like I was showing you earlier, you go in, we get a sample from the cervix, okay, which is the bottom of the womb, and we look to see what the result shows. So I had a question about what it means when the result says normal, ascus or atypical squamous cells of undetermined significance, low-grade squamous intraepithelial lesion, high-grade lesion, and cervical cancer. And I show you this not only so that you can see the progression. Whenever I'm talking with one of my patients, I like to kind of sketch out for them that abnormal cervical or PAP results are on a continuum. So what's going on is that if someone is exposed to HPV, it takes a high-risk HPV. It takes a very long time. It takes years for that HPV to remain undetected and to be there long enough to develop into cervical cancer. And so that's what the PAP test is checking for, whether or not there are any abnormalities with the cervical tissue. And then the HPV part is letting us know if that abnormality is associated or not with high-risk HPV. I say high-risk HPV because there are types of HPV that are what we call benign. So if you have genital warts that are due to HPV, that's a benign type of HPV. The type of HPV that causes cervical cancer, we call that high-risk types. They tend to be two types, type 16 and type 18. And so when we screen for HPV, we're checking to see primarily if you have those high-risk types. If your HPV test comes back and it says, oh, it's negative, or we only detect benign HPV types, then we're not as worried about you being at high risk for cervical cancer, okay? So a little bit more about HPV, because this is a question that I get a lot from my patients who are mothers and who might have children who are age 9. It used to be, the recommendation used to be to start the HPV vaccine by age 9. Now most of the recommendations, a child can get it as early as age 9, but most of the recommendations now say age 11 to 12. And that's for both boys and girls. And that recommendation for HPV vaccine is, again, to decrease the chance of someone developing a cervical cancer, or for boys a penile cancer or anal cancer if they were exposed to high-risk HPV. Okay, so that's what the HPV vaccine protects against. That once someone becomes sexually active, if they are exposed to high-risk HPV, they will have a lower chance of getting either cervical cancer, penile cancer, or anal cancer. Okay, so that's what that HPV vaccine is all about. I often have patients who will say, well, doc, you have 3 sons. Do you believe in the HPV vaccine? Absolutely. It's one of those vaccines that it really had many, many years when it was being looked at in research and development. It has a really strong safety profile, and it has definitely been shown to be protective when it's administered to persons before they're exposed to any sexual activity. Now, HPV is one of those things that when someone starts becoming sexually active, is very commonly transmitted. But it's also one of those things that very commonly is cleared from the body, which is another reason why the recommendations for Pap tests were pushed back, so that we don't react too strongly or overreact to those early HPV findings in younger women. So we talked about PAPs and what they are, what they screen for, at what age the recommendations say women should get them. Again, for most people, they're still starting that screening by age 21, but there's going to be a slow shift probably as the ACS or American Cancer Society guidelines are more routinely adopted. We're going to see more people probably pushing that age of screening, that initial age of screening, to age 25. And also remember, HPV vaccine, it can be given as early as ages 11 to 12. It's usually 2 doses over 6 months. If you have, there are some patients I have, and they don't want their child to get an HPV vaccine for whatever reason. There are a variety of reasons why people might have concerns with it. If the child is 15 when they get their first, or when they start that HPV vaccine trial, then they should ideally get 3 doses, okay, for full protection. Now, Janet has a question. Does HPV testing start at 30 years of age in general? How many strains of HPV does the vaccine protect against? Very good questions, Janet. So the guidelines that ACOG is still going by, and that some other professional organizations are still going by, say that if someone has an abnormal Pap test, and let me show this again, especially if it's abnormal like ascus, then that person should have an HPV test starting at age 30 to help us decide what should be done. Or actually, even if they're younger than age 30, sometimes the labs will do what we call a reflex test, and that says, let's say someone is 25, 26, and their Pap test is done looking at the cells, and those cells come back with, and it says completely normal. Those cells are completely normal. And that person, you wouldn't do a reflex test for HPV, okay, because the cells are normal. If someone is under age 30 and the cells come back abnormal, then that lab is going to do a reflex test for HPV, okay, so that it doesn't have to be done at baseline for someone under 30. If someone is 30 or older, then yes, the Pap test is going to both look at the cells from the cervix, but also look at the type of HPV that is present. So it's going to be a dual screen at age 30 and older, no matter what. Now, the thing about these new American Cancer Society guidelines is that they are very different from that. So what they are saying is that at age 25, you can only do the HPV test. You don't even have to get the cervical cells. You can do the HPV test, and if that primary HPV test is negative, you have a different pathway in terms of how you can manage that patient. Okay, so and then also in terms of the HPV vaccine, well, there are a couple of different ones on the market. Most of them will cover at least 4 strains. Oh, and that's something else to say to you guys, because I talked about the age at which you can, which most people recommend you give it, which is 11 to 12. But another important thing to know is that, and originally it was approved up to age 26. Another important thing to know is that FDA has recently approved the HPV vaccine to be given to women as far out as age 45, and that's because it's been shown that and women who may have had a potential new exposure or something that there's still some benefit in them getting the vaccine even up until age 45. So that's really good to know. If someone has certain types of HPV, but the vaccine might cover a different type of HPV because it can cover at least 4 types, some of the vaccines, and some of the newer ones are increasing the types that the number of HPV types that they cover. So it's good to know that a woman who comes in who may have a history of an abnormal pap, maybe the HPV strain analysis only shows that she's been exposed to a certain strain that's associated with high risk and potential cervical cancer outcome. That patient, if she's under 45, can potentially still get an HPV vaccine if it's deemed, after looking over everything with her clinician and figuring out what's going on and what types are present and HPV types are present and which ones are not there. A woman up to age 45 might still benefit from that. Okay, so thank you for that question, Janet. Great question. So the last thing I just want to touch on, and I want to cover this because this was a specific question that someone had for me. So I do want to say, just in terms of numbers, that there are about 13,000 new cases of cervical cancer every year in the U.S. And also every year in this country, about 4,300 women die. So it's something that's still very prevalent, something that we, OBGYNs really are try to be consistent about making sure women, if they have not had a screening test in a while, that they are able to access the screening test, that they're able to follow up on results, and that if additional steps are needed after that Pap test, that hopefully they can, remain engaged and get the follow-up steps from that Pap test. So when your Pap test comes back, it will say either one of these things. So when your provider is talking with you, they'll say, oh, it's normal, it's ASCA, it's low grade, it's high grade, and then they'll over here they'll say, maybe there's some early signs of a cervical cancer. And depending on what that result is, will dictate the next steps that you take with your provider. If it's completely normal, you may not have to have another Pap test for between 3 and 5 years, depending on whether you had an HPV test with it. If it's ascus or atypical squamous cells of undetermined significance, depends on if that HPV, high-risk HPV, is positive or negative. If it's positive, you have this test called a colposcopy, and that basically is like a microscope that we use to look through the speculum at your cervix and to look for any areas that might look to be of concern or that might warrant a biopsy. Okay, if you have ascus but your HPV is negative, then you can discuss that with your provider. A lot of times, many people will say, well, let's just retest in 1 year and see what happens. Low grade, high grade, those are again all things that in conversation with your provider, they require follow-up additional testing, usually with the colposcopy to take a closer look, see if biopsies need to be done. High grade, you probably need to have what we call a LEAP procedure or a cold knife biopsy, or basically just cutting out a larger part of that cervix. So when we routinely do a biopsy, a standard biopsy, we just try to get a little snip. You see where this little square is? Maybe we just want to get a small bite like that when we're doing a routine biopsy. But when we're doing a bigger biopsy, a cold knife cone biopsy, or what we call a LEAP, which is a loop electrical procedure that we do in the office or in the OR, we are actually trying to get a bigger chunk of that cervix so that hopefully we remove all abnormal tissue so that the tissue doesn't remain in place and then slowly evolve to cervical cancer. Okay, so that's what it means when we are doing different things, doing Pap tests, this routine exam that, a lot of women will come in and say, doc, I just hate this exam, and we get it. The speculum exam can be very uncomfortable. But when you're in your provider's office, your clinician's office, ask for different options. If the metal speculum bothers you, ask if they have a plastic version. There are different sizes of speculums that we can use. We have, really small pediatric ones, and we have small, medium, and large. And so, maybe if one is too large for you, or you feel a lot of discomfort, you can ask your clinician to use a slightly smaller cervix. So there are different things that you can do. And so those are the main things I wanted to talk with you guys about in terms of Pap tests, what they are. And just to recap, Pap tests are screened for cervical cancer. HPV tests are also screens for cervical cancer, and they can be done with a Pap test or on their own, okay? When we talk about normal Pap results, low-grade Pap results, or atypical cells, high-grade cells, those things all have different meanings, and they'll trigger a next step or a different conversation with your clinician depending on what's going on. There's an HPV vaccine. We talked about that a little bit. The recommendation is that it can be given starting as early as age 11 to 12. Actually, it can be given as early as age 9. If you choose to give it that early, your provider can do that for your child when you have them there for their pediatric visit. If your child doesn't start the HPV vaccine regimen until 15 or older, it's recommended that they get 3 doses instead of 2. And for women who are 26 to 45, FDA has now approved HPV vaccination for that age group as well, depending on different circumstances and after discussions with their providers. And so that's what I wanted to discuss today. I hope that I have answered the questions that have come up in the box regarding Pap test screening and regarding what low grade means. Let me see. Oh, a great question, Sean. Do we have to tell our OBGYN before or at our yearly appointment that we'd like for her to test for cervical cancer, or do they just automatically test for it? Excellent question. With the different guidelines in place, it's no longer automatic that at your annual visit, your GYN will check for cervical cancer, okay? If you saw your GYN last year and your Pap test was negative and your high-risk HPV was negative, your GYN or your primary care provider, because sometimes, it's not the GYN that does it sometimes, they will not automatically retest you for cervical cancer. They will likely say to you, Ms. Shawn, based on your result from last year, you are good to go and you don't need another Pap test for 3 years or 5 years, whatever the case may be in terms of the type of Pap and or HPV test that they did. Now, the thing is this, and this is important to keep in mind, because I still have some patients who are like, nah, doc, I don't trust those new recommendations. I don't care what the scientists say. I want my Pap every year. And there are patients who say that, and that's fine. A couple of things to keep in mind. It's okay if you feel like you want to have an annual test. It's important to discuss that with your clinician, because there are situations and circumstances in which it may be appropriate to do an annual test. If someone has new partners, if they have new symptoms that are of concern, if they're suddenly having bleeding after sex or something else that's new or different for them, it's okay for them to say, you know what, I know my test was negative last year, but I just want to be doubly sure because I've had some new things happen in my situation over the past 6 to 12 months or something like that. And then, of course, it would be appropriate for that clinician to have the conversation with the patient. It's important also for the clinicians to document, because what we're finding sometimes these days, and it doesn't happen too often, but it's always a risk. We always like to have the conversation so that the patient doesn't get an unexpected bill, because you guys know how insurance companies work. If they see you had a normal Pap and HPV test a year ago, and this year you had a repeat Pap, and let's say it came back normal again, then sometimes these insurance companies are challenging that. And so it's important for us as clinicians to document why we felt it was important to repeat that Pap test, okay? And when I'm saying Pap, I just mean the cervical cancer screening part. The insurance companies nor clinicians have any problem with doing annual screenings for, different swabs for sexually transmitted diseases, especially if it's someone who is newly sexually active or has a new partner or maybe has multiple partners. Maybe they have 2, 3, 4 partners, whatever, no judgment. They just want to be screened to make sure they're okay. And something like that is never challenged by the insurance companies. because, you know, that's what we do, or that's one of the things we do at baseline during an annual GYN exam. So, so great question. It is the case that your OBGYN will not automatically do a cervical cancer screen if you've had a normal or negative one in the previous year or two, but absolutely it's worth bringing up with your GYN to make sure you know which things she or he is screening for. Okay? All right. Great question, great question. Well, guys, it's 4:31. And, you know, I always promise you that I will try to keep you no more than 20 minutes, but I love when we stay longer because I hope that I'm answering all of your questions. And so with that, what I'm going to do is sign off for today. If you think of any other questions, please feel free to DM me or post it on the wall. And what I usually try to do is within the course of the week, come back and see if anyone has asked a question that needs additional coverage. Thank you so much, son. I appreciate your support and you being here. So that's what I will definitely promise to do during the week, to come back and answer any questions that pop up. So again, I appreciate you guys being here as we talked about Pap tests and when folks should get them and what do those results mean. And I hope you guys enjoyed the conversation. Again, if you enjoyed the content, please like my page, Dr. Madeline MD, and also share the page and the information, the live feed, the live stream that's going to be recorded on the page later. Oh, thanks so much. I'm glad you guys found it informative. I appreciate y'all. I appreciate y'all so much. Thank you, thank you. So next week, what we're going to do, the last time when we talked about flu shots and the COVID vaccine, I had a lot of follow-up questions from people about which vaccines women should get at what time points in their age, whether it's, you know, baby up to age 65 plus. And so next week, that's what we're going to talk about, those vaccines that are across a woman's lifespan and what we recommend in terms of science and knowledge and expertise and experience, what we've seen. So on that note, I'm going to sign off. I want to thank you guys again for being here. My name is Dr. Madeline. I'm your board certified OBGYN, international speaker, and published author. I help women access the GYN and birth control care that they need so that they can have maximum freedom and be in control of their lives. Please follow me on social media platforms, Facebook, Instagram, and Twitter at Dr. Madeline MD. That's DrMadeline MD. And thank you so much again for being here. Have a great Sunday.